Thank you so much. Thank you to everybody who has logged on to this presentation. I see some families that I've worked with many years ago. I've been in the field of autism and early intervention for close to 20 years. I have a master's in applied psychology with a specialization in applied behavior analysis. I'm a board certified assistant behavior analyst, preparing to sit for my BCaBA exam next month. So I do have a strong background in ABA. However, what draws me to early intervention and what has always drawn me to early intervention are the principles of early relational health. So I have been very fortunate to encompass what I know about behavior with the principles of early relational health in early intervention and working with young children and families. So we don't have that much time, so I really want to get started. I want to try to be as helpful as possible. I know that a lot of the feedback on this presentation was asking for strategies as opposed to theory. So that's what I tried to do here. So I'm going to share my screen. Just give me 1 second. Okay. And I am going to share a copy of this PowerPoint. So as Karen said, don't feel obligated to take screenshots or anything like that, because I'll make sure that I share it. I'm trying to minimize this. Okay. So today's topic is understanding and improving challenging behavior in young children. Again, my name is Stephanie. I'm the Training and Technical Assistance Coordinator at the Southern New Jersey REIC. So why are we here today? I'm trying to minimize. Can you guys see all of the waiting room stuff? Because I know I'm sharing my screen and I don't.
No, it looks perfect.
We just see your. Okay, good, because I can see it, but I didn't know if you guys could. Okay. So toddlers, as all of us know, whether we are parents or professionals, have complex and unique needs. And when we are working with or caring for toddlers, and we're trying to understand why they might be exhibiting certain behaviors, we do want to take away from today that all behavior has meaning, right? We all engage in a behavior because it works for us. We all do a behavior because we get something, we get out of something, or because it feels good, whether we are an adult, whether we are a toddler. And sometimes we have behaviors that challenge us, that make us think, why is this child exhibiting this behavior? What do I need to teach this child? So instead of doing this problem behavior, they're doing this instead. And as well-meaning parents and professionals, sometimes we don't always understand not only what the meaning is, but what we need to teach the child so that they no longer exhibit that behavior. In the early years, before children have strong language skills or some of those pre-verbal skills like learning through observation, imitation skills, attending skills, sometimes, especially for those with a diagnosis or developmental challenges, it can be even more difficult to understand what the toddler is trying to communicate. But if you take something away from today's presentation, it's that all behavior is a form of communication. So it's our job to try to understand why this behavior is happening, and then that will help us know what we need to teach in order to support this child's healthy development. So disclaimer, as a behavior analyst, I have to say this, every child is different. This is general information and strategies. Ideally, this would be something that you would do in a more individualized level. So just keep in mind, as a parent or as a professional, the same behavior for one child may mean something completely different for another. These are general information and strategies, and we always want to approach everything through an individualized lens based on the child's needs, based on the child's developmental functioning level, and the behavior. So I just wanted to take a moment and share that. So this is the agenda today that I'm going to go through. Reframing how we think about toddler behavior, action steps to understanding and improving behavior, general strategies that I've used a lot as a mom and when working with families for stopping or reducing hitting, throwing, and biting, and how to create supportive environments that nurture a child's development. So I'm going to try to make sure that I touch on all of that before we're done today. So reframing how we think about toddler behavior, right? So we don't just want to look at the what, we really want to focus on why. But toddlers aren't bad, as I'm sure all of you already know that, right? They're learning. They're not manipulative. This behavior is not premeditated. They're not giving you a hard time purposefully. Most times these little children are having a hard time as opposed to giving us a hard time on purpose. At this very young age, before age 5, they do not have the brain structures in place yet to engage in logical reasoning, emotional regulation. They have little concept of time and live in the moment. So sometimes what people think, this child is misbehaving, not listening, non-compliant, or what it looks like on the surface level, what's really happening inside, or what's really happening in the environment that might be contributing to this behavior? Is the child tired, hungry? Are they having an inability to communicate? Imagine knowing what you want to say, but not being able to say it. Or imagine you're so young and you don't have those brain structures in place yet, or that emotional regulation to even really know what you want. You just know that you need something. You need some type of help, whether it's an item or attention, or what's being asked of you might be too hard. They could be in sensory overload. They could have an unmet need, seeking connection, difficulty understanding instructions. For a lot of toddlers, especially those with autism or with language processing delays, it's very difficult for them to understand language. So sometimes we think if we explain more and we use more words, it's helpful, where sometimes it's actually hindering and more confusing. So getting to know your child's unique needs and their cues is a really important way to understand their behavioral needs and what they need to learn. So a few reasons behind, quote, bad toddler behavior, right? So as we're looking at reframing behavior, just keep in mind these few things that oftentimes all correlate to problem behavior. So they're still learning the rules. A behavior is done because it works, right? We all engage in behavior because we like the outcome. If we didn't like the outcome, we wouldn't do it. And at a very young age, toddlers are learning what behaviors result in what outcomes, right? They're still testing boundaries. That's normal. That's how they learn. This is okay to do. This is not okay. This results in me getting something I really like. This results in me getting something that I don't like, or getting out of something I don't want to do. They're still testing limits to learn what the expected behaviors are and what the consequences will be. Consequences are how they learn to what works to get what they want. Sometimes that's a behavior we like, and sometimes that's a behavior that we don't like. So we need to be consistent, whether it's, mom, dad, the babysitter, in terms of how we respond to a behavior we want to see more of, or a behavior we don't want to see anymore. We all need to be mindful and on the same page with how we respond to that behavior. They're still developing receptive language. So receptive language is our ability to understand the meaning of words. Oftentimes we forget that these children are very young, that they may develop mentally beyond a 19-month-old level, even though chronologically they may be 24, 28, 30 months. We really want to be mindful of chronological versus developmental age. Sometimes when we give a simple direction, we might need to give our toddler additional response time. They might need extra time processing language. Oftentimes, it's very normal they have a short attention span, but a lot of times, when, especially we're dealing with toddlers that have developmental delays, often it helps to show them what that direction means. Go get your shoes, watch mommy do it. Or doing video modeling and letting them see what that behavior looks like. Giving a direction doesn't always mean that they understand what it means, or doesn't mean that they're going to naturally learn how to imitate based on observation. A lot of times when you have a child that has developmental delays, learning through observation isn't that easy. Just because everybody in the daycare classroom is doing it doesn't mean that it's really easy for them to understand those directions or understand how to imitate or what the words mean. So sometimes using pictures, pairing a direction with a gesture, or just simply modeling what that looks like, slowly fading all of those additional supports back. But in the beginning, if you find that direction following is hard, use pictures, use gestures, model it for them. Their communication is limited. So can you imagine how frustrating it would be if you knew exactly what you wanted, but no one around you could understand anything you were trying to say? How would you get your points across? How would you get your wants and needs met? Through behavior. So you really want to try to look at, what is this behavior communicating? Does my child need something? Do they need help or a break? Do they want to play? Do they need an item? Are they frustrated and can't tell me? Just being mindful that they might not be able to tell you what it is that they need, whether that's through words or even through gestures or through pictures. If you have a child who has a lot of expressive communication delays, I always encourage families and professionals, teach them how to communicate through gestures, through sign, through pictures. All of the research shows that that is a bridge to communication. And oftentimes I've worked with many families that have said, well, if we give them sign language or if we give them a picture board, that's going to hinder expressive communication. That's actually the exact opposite. Oftentimes you'll see a reduction in problem behavior, and it's a bridge to spoken language sooner. So just something to keep in mind there. Sometimes we have unrealistic expectations. So just be mindful. Is this a can't do or a won't do? Is this a skill deficit or a performance problem? Is this child unable to actually do this and I'm asking them to do a 3-step direction when they're not really even able to understand basic imitation directions? Or is this a won't do, meaning they know how to do this, they're just not motivated and they're not doing what I want them to do? How could I change how I deliver that instruction? What type of motivation or reinforcement could I incorporate into their daily routine so that they're more motivated to do what I want them to work on? So just being mindful of skill deficit versus performance problem. And a delay with pre-verbal skills. So before expressive communication really takes off and a child is able to label emotions or label things they see in their environment, ask for things that they want, juice, cookie, more, up, play. Oftentimes they have mastered what we call pre-verbal skills. So eye contact, joint attention, imitation skills. A lot of those times when we have children with developmental delays, they not only have difficulty with expressive language, but they're having difficulty with some of those pre-verbal skills too. So sometimes while we want communication to improve so that they hopefully no longer exhibit these problem behaviors as a means of communication, don't forget the importance of pre-verbal skills. Don't forget the importance of imitation skills, joint attention skills. I could talk for 5 hours on joint attention. It's it's a very important skill that a lot of times in early intervention is worked on, and it really leads to better communication and social emotional outcomes. So essentially, a lot of these things all correlate to problem behavior. So just looking at chronological versus developmental age, is this a can't do or a won't do? What sort of skills should I really be working on so that hopefully an increase of these skills results in a decrease of problem behavior? So this slide is look past the what and focus on the why. So as I was saying, look past the behavior we see, try to understand what's going on inside. Are they tired, hungry, bored, seeking connection? What's also happening environmentally that may be contributing to the behavior, especially when we are parenting or supporting children on the autism spectrum who have a lot of sensory challenges and sensory sensitivity. So really look at what's going on in this environment. How could I make this a more calm experience? How could I deliver this instruction in a way that's easier for my child to understand? Approach the behavior through a more informed lens. And I always say we really should be spending 95% of our time preventing problem behavior. Sometimes we are in the thick of a problem behavior and we do need to be reactive, but we really want to look at what is the meaning of this behavior? How can I prevent this from happening? So when addressing a problem behavior, the reason behind it is more important than the form that it takes. So take pinching, for example. I worked with a family before and I got to my session and mom had said, my daughter keeps pinching, what do I do? So I said, I don't know why she's pinching, so I don't want to recommend a behavior plan or tell you to work on something that might not be meeting the need of this pinching. Is she pinching because she gets attention every time she pinches? Is she pinching because when she pinches herself, you find her favorite squishy ball and you run over and offer it to her to stop the pinching and give her a safer alternative? Is she pinching because she gets reprimanded for pinching and is sent to timeout where she doesn't have to do something that maybe she didn't want to do in the first place? Or is this pinching internally, intrinsically motivated, meaning it's nothing to do with the environment, it's something that she's doing that makes her feel more calm or regulated. So until I really know why pinching is occurring, instead of just the what, I want to know why it's happening before I know how to change it. So the way that we do this is we really look at what's going on before pinching starts. How am I responding to pinching? Am I seeing any patterns? Is she pinching every time she's given a direction? Is she pinching every time we sit at the table to color together? Is she pinching when she's having a ton of attention and no demands are being put on her, which might tell me this is more of a sensory internal based behavior? You really want to look at when this behavior is happening, what's happening right before it, what's happening after. That will help me try to understand a pattern and how I can change that pattern. So as I said, behavior is a form of communication. There are 4 common functions of behavior. Sometimes a behavior can mean one thing during certain situations and circumstances. And then there are other times where the behavior might be used for a completely different function. You always want to make sure when you're trying to understand the function of a behavior that you rule out medical causes first, especially when we're talking about behavior that is dangerous and self-injurious. If you have a child who's hitting themselves in the head, who's banging their head on hard surfaces, who is biting themselves or picking their skin, anything like that, you always want to make sure that you've ruled out medical causes first. After you've ruled out medical causes, there are 4 common functions of behavior. So attention, that doesn't always mean positive attention, right? A lot of young children are sometimes motivated to engage in behaviors that often even result in negative attention. Even being reprimanded or being sent to timeout is a form of attention. Item or activity. So are they doing this behavior because they want a toy or their video turned on or a snack? So for example, a student tantrums when given a worksheet, the teacher presents a puzzle instead. Are they doing this behavior to avoid or escape something? So the child runs away from the dinner table when undesired food is presented. Or you may have a child who protests their food, throws all the food on the floor, and then they're sent to their room or they're sent out of the room where they no longer have to eat the meal. And then eventually mom offers them a different meal. So they've completely escaped that meal and that dinner time experience. Or is this self-stimulatory? So this is also referred to as automatic reinforcement. This occurs for internal reasons, so not extrinsically motivated behaviors like hand flapping, spinning, things that are occurring when there's really no demands being placed, when there's a lot of attention, when there's a lot of preferred items around. But keep in mind, just because it is a physically motoric behavior does not mean it's always self-stimulatory. I've worked in a lot of classrooms where we just automatically assume rocking and pacing is self-stimming, and there's a lot of times where these children are using that to escape doing a certain task. So just keep that in mind. Just because it's physical in nature, it doesn't always mean that it's self-stimulatory. So those are the common functions of behavior. So when you're looking at your toddler, when you're looking at this problem behavior that's occurring, this slide can maybe be a reminder of, oh, do they need attention? Has it been a while since we've played together? Maybe I'm asking them to do something that's too hard. They're trying to avoid it. Maybe they want an item or activity that they don't know how to ask for. And every time they flop to the ground, I end up offering them this item. I wonder if I should give them a better way to ask for it, but they can't talk yet. Well, you can teach them to sign. You can give them a picture book. Almost every early intervention family I worked with, we made a personalized picture book where it was just like a photo album or a 10 picture item of help, their favorite snacks, play with me, squeezes, different things that, because I knew this child could not say words yet, I wanted them to have a way to communicate. If you are working with a child that cannot talk, and keep in mind, there is a huge difference between having a lot of words and having functional communication, right? So I've worked with tons of families that say, oh, they have 50 words, but they have no functional language. They can't ask for help. They can't ask for their favorite items. They don't know how to ask somebody to play with them. They don't know how to ask for squeezes. So they might know their colors and their numbers and letters and shapes, but do they have functional language? And if they can't really use those words in a functional way, it's our job to teach them how to sign or how to point to a picture. We want to make sure they have some way to communicate. So that I just always like to point that out. There's a big difference between functional language and having a lot of words. Okay. So action steps to understanding and improving behavior. So we've kind of looked at reframing the behavior. This child isn't giving me a hard time in a premeditated way. How can I reframe how I'm looking at this? What are the functions of behavior? Do you think this is an unmet need? What can I teach my child so that they're no longer using this behavior to get these needs met? Now I want to talk about some action steps to understanding and improving behavior. Okay. So I'm going to share a video from the Autism Speaks video glossary. And this really illustrates, it's an older little boy, but it's a really powerful video. He is, I think he's about 6, and he is on the autism spectrum. And it really illustrates the importance of connecting our behavior plans, or what sort of recommendations we're making when we're working with families, or as a parent, what sort of approaches we're doing, looking at the function of the behavior. Why is this behavior happening?
What do you need? Come on, buddy. Come on.
It's okay. Let's clean up really quickly and you'll be finished. You'll be finished.
Hey.
Let's
Come on.
really quickly. Come on. We'll just clean up.
Julie is not going to know what's going on when she comes in tomorrow and don't clean up. Hey, buddy, come on. It's not so bad.
Robbie, come on. Come on and clean up.
Maybe some of these letters got thrown in.
Did some of your letters get in there?
Some of your letters get in.
Come here. Let me see what you have. T-H-E-E-N-D. It's all here. Look. The end. It's there.
There might be other letters even.
It's okay. You have the end. Okay?
Okay, now come on, Robbie.
So you hold the end. Now let's clean up the other letters. Come on, help mommy. Good boy. That's it. So you have the end.
Hey, Robbie.
Yeah, Robbie.
Good job. Good boy. He just wasn't sure he had his end.
So that video really illustrates, it wasn't that he didn't want to clean up, right? It was that he couldn't say, you know, help, my letters are in there, my letters are in there. So when I first saw that video, it brought tears to my eyes, because it's just an example of a child on the autism spectrum, for example, or a child with expressive communication delays that can't say what they really want to say. So instead, he started screaming, and then that wasn't getting him what he needed. So he started biting himself, and then he tried to bite mom, when really, you know, I could come up with a great behavior plan for cleaning up, but it had nothing to do with him trying to get out of cleaning up. In that instance, he wasn't able to say letters. So now that you know that, now that we know that, what I would always do before cleaning up is making sure that not only as a therapist in the home, I'm working on teaching him how to sign or say or ask for letters, so he doesn't have to resort to those behaviors anymore to ask for those things, as well as just looking at, don't always assume that we know the reason behind the behavior. There was a research study done many years ago, and it was a group of professionals watching children engage in certain behaviors, and then after they did a more formalized assessment of the behaviors, 50% of the assumptions as to why those behaviors were happening were wrong. So a lot of times, before we just assume, assess, really look at, what is the pattern of this behavior? What's happening right before and what's happening after, so that I can learn What is motivating this behavior? How do I prevent that behavior from happening again, not just for myself, but so that that child doesn't have to experience that level of stress again either? What can I teach them so that they can so he can ask for his letters in a better way? How can I support him for success? So when we're looking at assessing the target behavior, we're looking at patterns. When this behavior happens, am I noticing facial expressions or gestures that the child is using before they even escalate to flopping or scratching or throwing food off the table? What feelings am I seeing on that child's face? What gestures or movements are they using before the behavior happens, right? Really looking at those precursor behaviors to the problem behaviors. Does this behavior happen at a certain time of day? At childcare drop-off or bedtime, in a certain place, in a brightly lit room, in a noisy mall, in a particular situation, like when the child must cope with many other children at one time, like at the playground or in a classroom with a specific person. I worked with a little boy before who I was a one-on-one for him, and we were taking some data on how many times he would run out of the classroom. And with me, he would pretty rarely, maybe once or twice a week, run out of the classroom that he was in. And then with his other one-on-one, we had noticed he was doing it 5 times an hour. So we were trying to understand what's happening here. What are we doing differently? And we realized that the other therapist, well-meaning, wonderful therapist, was hand over hand prompting this little child. And he hated that, but couldn't say, I don't want you to touch me. He did better with gestures and pictures. So we made him a picture schedule. So for example, when we were doing craft time, I had a picture schedule where it would say like scissors, glue, cut, all done. And he liked to follow the pictures. And I would bring that with me a lot and use pictures. I'm a big visual support person. I think visual supports are very helpful for toddlers, as well as children with certain diagnoses and processing delays. We all use visual supports, right? We use our iPhones, we use calendars, we use to-do reminders. When we have children who have difficulty with directions and we have difficulty with following a schedule, I always recommend visual supports, making it easier for them to understand with pictures what the expectations are and the steps in an activity. So we realized that he didn't like to be hand over hand prompted to do things. And once we changed that, he did really well with the other therapists as well. So just really looking at what's happening here with the child in the environment. How can I make this easier for them, simpler for them to understand, more motivated for them to exhibit the behavior that I do want to see, right? And assess the influence of other factors: diet, sleep, health status, changes in family schedule, other interventions that they may be starting. It's always important to assess the influence of those other factors as well. So you really want to look at the child, you want to look at the environment, try to uncover some patterns of behavior. Once you've uncovered some patterns of behavior, use your assessment to make a plan based on what you think the meaning of the behavior is, right? We're not always going to get it right. You try again the next day. Everything's not going to work perfectly all the time. We're not always going to find the function of the behavior right away. And even when we do, they're kids. It might change again the next day or the next week, but it's an important informed lens to look through. What is the meaning of this? What functional alternative skill can I teach this child? So instead of hitting me and grabbing me and biting and flapping and running away, they do something else instead, even if it is to protest, even if it is to decline, even if it is to say, give it back, or my turn, or I'm all done, I need a break. That's okay. It's better than hitting, kicking, screaming, and biting. Teaching them how to appropriately and safely ask for what they need or want, protest things that they might not want or need. Toddlers have opinions and autonomy too, and we want to respect that while also having boundaries, but also making sure that they also need a way to communicate things that we as adults want to communicate sometimes too. I need some space. I need some attention. I don't want to do that right now. So once we determine what the behavior is accomplishing for that child, we need to find a more appropriate way for him or her to get what they want, using what we call a functional alternative. So there's something called the fair pair rule. So for every inappropriate behavior targeted for reduction, we need to teach at least one new alternative behavior. Otherwise, you're just putting a Band-Aid on a maladaptive, unwanted behavior. If you don't teach them something else to do instead, they're just going to do a different type of unwanted behavior. They're doing that behavior because it's working for them. So we need to help them along to do something else. And that also comes with no longer providing that reinforcement for the unwanted behavior and supporting them, providing them with additional support and reinforcement and praise and other types of motivation for them to engage in this new behavior that we're going to teach them. Because in the beginning, it's going to be difficult. This is a new skill that we're teaching them. I worked with a little boy a lot who would hit himself in the stomach and flop to the ground every time he needed help because mom or dad understandably would come running in and offer him the help that he needed. So I said, when he's doing this, we need to see when he starts getting agitated. So hopefully we can step in and help him before he gets to that level of frustration where he is hitting himself, which he is doing for attention and for help, and teach him how to sign for help. He couldn't talk yet, so we were teaching him how to sign. He also had a picture board on the wall of the kitchen, so we were teaching him to walk over and point to help. And I said, as soon as he even attempts to sign for help, we need to provide it. Even if we're fully prompting him help, we're still going to give him help and praise him for doing that because that's what we want him to do instead of hitting himself in the stomach. We want him to start learning, if I'm going to get help, I'm going to sign for help or I'm going to touch this picture. Because otherwise he was just going to keep doing what he was doing, which was harmful to himself. And it was upsetting to mom to see him doing that. Okay. So we want to teach them more appropriate ways to get their needs or wants met, whether it's attention, items, escape, or sensory based. So when attempting to change behavior, we want to always focus on what to do rather than what not to do. So many times we always say like, no hitting, no running, no yelling. It should be walk, use safe hands, use an inside voice. Providing verbal models. I don't really like use your words. If they could use their words, they would use their words. They need you to help them give them those words. So if we see that they're hungry and they're walking to the kitchen and they're getting frustrated, it's not, what do you want? Tell me what you want. Use your words. It's cookies, apples, juice. You can still provide those verbal models so that hopefully after you say it, you pause, say it again, pause. The third time you say it, you would hand it to them. So we really want to provide those words or gestures or signs in place of those unwanted behaviors as often as possible. We want to have a functional equivalent replacement behavior. That's a positive alternative behavior that allows the child to have the same outcome. So even if they do want to escape an activity, let's teach them how to sign break. Let's teach them how to sign help. Let's teach them how to sign or say all done. Or maybe we shorten the task or we make whatever aversive activity they might be finding aversive more pleasurable for them. If we find that they start escaping this activity after 3 minutes, change the activity to 1 minute so that we can, end on a really good note and this activity becomes less aversive so it reduces the likelihood of them engaging in those escape maintain behaviors. Okay, so it's really important to just keep in mind for any behavior you're trying to reduce, you have to teach a functional replacement skill. So, for example, you might say to a screaming toddler, you pick up, are you saying that you want up? I can pick you up. So if they're screaming or they're, doing things with their hands, they're doing a lot of whining, use that as an opportunity to pair that with a word. Over time, especially if you know that they know how to say up, I would not pick them up until they use their words and say up. If communication is difficult for them, you would shape that up, right? So they don't have to say up perfectly and clearly. You would reinforce any attempt for them, even if they quietly lift their arms up. They're not screaming or grabbing at you anymore. By pairing and using language or a gesture to describe what that child is communicating, you're teaching them the meaning of words. So always model and label. You look really upset or mad. You need help. You're all done. You need a break. So you really want to make sure that you're creating as many opportunities as you can to teach them how to use words in a better way and get reinforced for using the right words, the right skill. So another example, if Michael used to get attention when he poked his mom repeatedly, now she might not provide attention until he stops and calls her name. So if reducing poking and pulling on my shirt was something that was important to mom, we would really want to work on teaching that child how to say mama or mom, or signing play, or maybe just quietly tapping instead of pulling and whining and screaming. A lot of times when we do kind of turn the tables on what new skill is going to get reinforced, it sometimes gets worse before it gets better, because in a toddler's mind or anyone's mind, they're thinking, well, this used to always work for me and now it's not working for me, because we're trying to create more teachable moments for them to use the skill that we want them to do. But don't give up. A lot of times it might get worse before it gets better, but that doesn't mean what you're doing isn't working. It means you're kind of creating a different outcome expectation that you want your child to exhibit. Okay, so if Sarah gets out of her high chair for throwing or dropping her food on the floor, she now might only get up when signing or saying all done, independently or with help. So I really want to clarify that. It's okay to withhold reinforcement for the unwanted behavior and provide it for the behavior we want to see with help. We don't want to wait until they do it perfectly and independently. They will get so upset and frustrated. We want to make sure that we are providing whatever additional support they need to learn how to do these things. And then making sure that we're reinforcing them for doing them, because it's not going to be easy, especially in the beginning. But if you're consistent and everybody's working on it, whether in the moment or proactively throughout the day and daily routines, they will eventually learn the behavior that they need in order to get the certain outcomes that they want. So the last one, so we've kind of looked at patterns. We've developed a plan on what skills we want to work on and what skills we want to teach. We've identified what functional alternative skills we're going to be focusing on. We really want to make sure that we are proactive to reduce the problem behavior from reoccurring, right? So now that we have a better informed lens as to when this behavior is happening, now I know more about it. I know, it's happening a lot during transitions. It's happening a lot when no attention is being provided to my toddler. It's happening a lot when they're presented with a non-preferred task. How can I make this more reinforcing? How can I prepare my toddler and me as a mom for success? What can I do? So we really want to look at being proactive and preventing problem behavior. So rather than thinking about how to punish the child, right, for their behaviors, which we don't want to do, this approach is not to be punitive. It's not for yelling and scolding. Many times that is not going to work. You're just drawing attention to the behavior, right? We really want to work on how to prevent this behavior from reoccurring. And I always like to say this, what usually will not work: yelling, threats, bribes, timeouts, talking more and more while your toddler is in the middle of, a meltdown, or hitting or biting, making the child say sorry. A lot of times this is just drawing attention to behavior. So when, Johnny's hitting or throwing things and we're saying, okay, if you throw one more time, we're leaving. When you're talking about things like that in the middle of a problem behavior, that's a threat. And sometimes we're as moms, I've done it a million times, we're making threats for things that aren't even going to really happen. Like, if you do that one more time, we're leaving. If you stop doing that, we can go up and get ice cream. When you're talking about things like that in the middle of the behavior, you're just drawing attention to it. So I really try to avoid all of these things. I'm more of a proactive, preventative. What can I teach? How can I praise you for doing, all of the good things? So I really don't recommend, talking more and more, while your toddler's in the middle of a problem behavior, yelling threats and bribes and timeouts. You're just drawing attention to the behavior. So I really try to avoid those things. So, these are some proactive strategies that I think they can be really helpful. It depends on the behavior. It depends on the child. Schedule periods of attention. I always recommend at least 20 minutes a day. When your child is happy, relaxed, they're fed, their diapers changed, you can sit and work on all these proactive skills that you want to work on. Try to schedule periods of attention. If you notice every 20 minutes your toddler's having these attention-seeking behaviors, provide them with attention every 15 minutes, even if it's a couple minutes, like, Mommy's so proud of you. I love how you're sitting. Let's go do a puzzle. Let's go play a game with Daddy. Even if it's for a couple minutes of your time, if you notice every 20 minutes they're engaging in attention-seeking behaviors, use that informed lens to prevent it. Anticipate problems. So if transitions are a challenge for your toddler, if after a play date is likely to cause frustration and tantrums, discuss the behavior you want to see with your child before you go to the play date. This will depend on functioning level, right? But I always talk about, being proactive in terms of we're going to have nice hands, we're going to take turns, we're bringing our dinosaur, they might have their own dinosaur, but we're going to play with yours. If we need help, we can ask for help. Mommy will be there with you. Always try to anticipate how you can ease this transition, how you can explain the rules beforehand. So recognizing triggers and responding early. If you feel that your toddler is in a place where they are getting overwhelmed and they're clenching their fists, or they look like they're about to bolt out the door, try to be aware of those things for next time, so that you can maybe prevent them from occurring. Providing clear expectations. So we always want to say what we want to do and not what we don't want. So we're going to keep our hands down. We're going to walk. We're going to eat at the table. First, we're going to eat, and then we can have ice cream. If we outline these expectations before, that is explaining to our child what we expect before and not during the problem behavior. Demonstrate the desired behavior. So watch Mommy do it. Look how Daddy's helping. Practicing that during daily routines, and always modeling. I don't like when we tell anyone what to do without showing them what it looks like, right? Reinforcing desired behavior and always being more specific than good job. Great job. I like how you're looking at me. That was such nice sharing. I love how you're eating and taking safe bites. I like how you're walking slowly with your brother. I'm so proud of you. So just being mindful of those types of things and having clear expectations. So I like first then, if then. This is not the same as a bribe, because bribes are occurring while a problem behavior is happening. So this is all about setting clear expectations in advance. So prompting. Prompting is the formal term for any additional support you provide. So whether it's a gesture, whether you're saying come here and you're pairing that with a gesture, maybe you're using pictures, maybe you are doing hand over hand prompting. Let me help you. Depending on the child and what they take to would depend on what type of additional support that you offer. So offering choices, sometimes, especially with toddlers, if you give them a little bit of control, they're sometimes more likely to listen. So do you want the red one or the blue one? Do you want to go to the library first, or do you want to go to ShopRite? Provide choices with the order of activities. Do you want to have dinner or do bath? Sometimes those are bigger choices than we can offer. But, even if it's little, sometimes, taking into consideration what choice they may have still lets them feel that they're kind of winning, but also kind of listening to you. Role playing, so setting aside time where you can practice these things, maybe reading about it in a book. Video modeling is when you let the child watch videos of other children doing the target behavior. So I've had some success with that with picky eating. Waiting. A lot of times toddlers think wait means no. When we say wait, it means it needs to mean yes. So when we are working on having our toddler be more accepting of the term wait, waiting in the beginning should mean 2 seconds. So, okay, you can have that, but just wait. Great job waiting. And then over time, you would expand how long they wait. They're just desensitizing that aversive term of waiting. So you just want to remember that when you are working on waiting, wait means yes. Sometimes in, mom world and parenting world, waiting actually means no. I have no idea when you're getting that, but you're waiting. But if that's a word, that's a trigger word for your toddler, start using that word when it actually means yes for something that they are waiting a short time for. Then over time, when they hear that word wait, it should be less of a challenge. Turn taking. So patience and tolerance building is really important. So I've worked a lot with kids on turn taking with a toy drum or a ball because it's one item that you're passing back and forth. Sometimes when we're doing turn taking and it's with items with multiple parts or duplicates of an item, it can kind of make turn taking lose its focus. So I would recommend a ball or a toy drum, like my turn, your turn, daddy's turn, you know. So those are the things that I've used with turn taking, and restate how your child seems to be feeling and offering different ways to help them be calm. So sometimes when we're not in the thick of a really big problem behavior, it's okay to say something like, you look really mad. Let's take some deep breaths. Or I know you're sad. We don't have the blue marker, but we have red or yellow. So you look really excited. We can't jump on the couch, but we can do some hugs or we can do frog jumps together. So kind of restating how they're feeling, giving them a choice of something else if they're doing something that you don't want them to be doing. So these are just some proactive strategies that I work on a lot when I'm working with children that are exhibiting a lot of problem behaviors, because again, we want to teach them these proactive skills. So general strategies for hitting, throwing, and biting. So I really talk the most about prevention, but what happens when you're in the thick of a problem behavior, which all of us have been in, and I've been in a ton of times, and you're wonderful moms and dads and professionals. We're not always going to handle it the right way, but don't give up. Keep trying. The most we can do is try, right? So biting, hitting, and throwing. Even though a toddler might be exhibiting these behaviors, even if they are overwhelmed, even if they can't expressively communicate wants and needs and emotions, these behaviors should not be excused. They can get thrown out of daycare for throwing certain things or biting or hitting other children, right? So we really want to make sure as early as possible that we are teaching these children that these behaviors are not okay, especially after around 18 months. They should not be doing these things, especially at high rates. So major problem behaviors are usually an indication that the toddler can't communicate well, and we're going to do proactive strategies, teaching them how to communicate. Oftentimes, these behaviors might mean I can get attention, I can get out of things. This behavior gets big reinforcement or a ton of attention. Right. So it's a struggle that many parents face, but it's really not okay to accept major problem behaviors like biting, hitting, and throwing, regardless of diagnosis or delays, right? We can still teach these children. We want all children to be as happy, safe, and independent as possible. And, oftentimes I worked with children that have, very mild autism. I've worked with children that have profound autism. I've worked with children that don't have any delays at all, just have a lot of problem attention-seeking behaviors. They've all learned from, different proactive strategies. You can teach any child. It just takes a lot of consistency and taking the time to teach them what to do instead and changing how we respond to these behaviors. So I just wanted to kind of highlight it shouldn't be excused. Oh, this is the terrible twos or terrible threes. These are behaviors that we can change, right? So biting. Biting is really serious, even if it's playful biting, right? Happy bites might mean they want to play or wrestle. Oftentimes, a lot of research has shown that biting is correlated to stress or pain. So I always recommend when we have a child who's biting themselves or biting others, to get a medical assessment done. They might need blood work, an ear check, dental check, because a lot of our kids can't tell us when they're in pain. So you really want to focus in on when the biting is happening and when it doesn't happen. So that kind of circles back to that 4-step approach we reviewed before, right? Assess patterns. When is this happening? Under what situations? With what person? Under what conditions? Or is it when they're tired or hungry or bored? Oftentimes when I have a toddler who's biting, and I'm just going to kind of share what I typically have done. Again, this is always going to be individualized. It may not work for everyone. I always say we really want to be the spoiling grandma, right? So we really want to be, I listen to Dr. Mary Barbera a lot. She is an RN She has a child on the autism spectrum. She's also a doctor level behavior analyst. She always says, be the spoiling grandma. And sometimes we need to be the Monday morning quarterback and try to understand what went wrong there. Right. So when a toddler's biting, if you're in a play situation or you're holding that child, typically what I would recommend is to say no in a firm way. We don't need to be yelling or punitive or scary, right? A firm no. If you're carrying them, I would put them down. If you're playing with them, I would get up and walk away. Remove yourself from that situation for about 30 to 60 seconds. Sometimes that child might get more upset. It's okay to help them calm down, but I would really say, no or no biting, kind of change your affect. I would get up and walk away so that they know there's a clear distinction between what they just did and there's been a change in what's going on now in my environment, right? So now I'm not playing. Now mommy put me down or daddy put me down or they just left the toy area. I'm not getting any attention right now. I would really try to pay them minimal attention for 30 to 60 seconds. Then after that time passes, the slate is clear and you move on. You try again, right? There needs to be a distinct consequence where what was going on is removed and then that reinforcement gets turned back on. What we don't want to do when they bite is, oh, don't bite me. That hurts. That's not nice. You can't be biting. That's not right. We need to use our words. Biting's bad. Biting's not good. All you're really doing in that moment is giving attention to biting. They just bit and now you're talking about biting. And for some kids, that's reinforcing. We still want to talk about the appropriate things to do, but that's when we want to work on those things in a more proactive time. So when we're feeling frustrated, we can use our words, we take turns, we ask for help. But if they just bit you, I would respond by 30 to 60 seconds of no reinforcement, put them down and say no firmly. That's typically what I would recommend. Okay. Again, it's going to be different for every child, but it helps for them to understand, oh, that changed. I just bit and now I'm getting no attention. So-and-so just walked away. I'm not accessing that reinforcement that I was. And then after that minute, I would really move on. Sometimes you might have a child who's crying and it's okay, okay, I see you're really upset. I can pick you up, but I wouldn't keep talking about biting. We say no firmly, and then I would try to do 30 to 60 seconds of no attention. Sometimes that child will get a little bit upset and they'd be able to calm themselves down. Other times you might have to help them be calm. There's a big difference between attending to a behavior and attending to a child, right? So you can help the child calm down, but I wouldn't keep talking about biting. I wouldn't have them go say sorry for biting. I wouldn't keep mentioning biting. Don't call someone on the phone and say, oh, they keep biting me. They're just going to realize that they're getting attention from biting. Okay. For hitting and throwing, a lot of times hitting and throwing is it's really normal, but talk about the rules before you go somewhere. So when we get to your friends, we're going to have safe hands. We're going to take turns. Sometimes for some toddlers, especially ones that throw toys, I'd recommend that they don't bring things other places. Sometimes it's a comfort thing and they might need to bring things and that's okay, but review those rules with them before. As soon as the toy or the toy is thrown or they hit, again, remove the toy, remove the attention until that child is calm. I would recommend an immediate, firm, but calm intervention, right? So a quick intervention, 30 to 60 seconds without extensive verbal communication to prevent reinforcing that behavior. So no or no hitting, removing yourself from a place where you can be hit or thrown at again. This acknowledges that the behavior is not okay with a lot of words. So again, avoid that, limit your acknowledgement of negative emotions. So that hurts, you can't hit, you can't throw. Work on those things during a more neutral time. So if a toy train is thrown, the train is taken, mom walks away for a period of time, give attention to someone else. When the child, giving the child space to calm down, when the child's calm enough, they can maybe ask for their toy back, and then you would move on and you wouldn't keep talking about hitting and throwing. Now, again, I know some people are probably, hearing some of these strategies, maybe you have different thoughts on them and that's fine. I'm just doing what has worked with me in terms of just a distinct change. We're having fun. We're doing this. We're doing that. Now you threw, you hit, you bit. 30 to 60 seconds of I'm removing myself. I'm not giving you attention. I'm removing the train that you threw at me. I'm walking away from you because you just bit me, but I'm not talking about all of that. I'm just removing that attention and that reinforcing state until, maybe 30, 60 seconds. If you need to help the toddler calm down, that's fine. Okay, let's take some deep breaths. You can model the word that they might want to be using instead. But again, not really giving too much attention to the fact that they hit, they threw, they bit. Working on those self-regulation skills, communication skills, and play skills during those proactive times, not in the middle of a problem behavior. Now, I'm a realist, so sometimes there are times where a toddler flops down in the middle of a parking lot and we just need to keep them safe, right? So, okay, get up, we can go get a cookie. You just need to get them up. If they're too heavy for you to pick them up and you need them to get up because they're in the middle of a parking lot, sometimes we say those things, right? So you need to get up, we can go in and get a cookie. But then what we want to do is, okay, how do I prevent that from happening next time? Should I give them a picture of a couple things from a magazine that we're going to go find in the store, holding their hand while we're doing it? Just different ways to be proactive and preventative. But sometimes when we are in the thick of a problem behavior and it's happening right then and there, these are some things that have worked for me. So again, it's always going to be individualized based on the child and behavior. I just have like a couple more slides, if that's okay. So just some reminders during and after problem behavior.
Excuse me, Stephanie, just a second. Yeah, just a few more slides. We want to, we will be around to go over these slides and answer questions, but I also want to let those of you know who are trying to, multitask and do 25 things. If you need to go, we understand.
Yeah, of course.
You're going to be getting all of this information. If you do have a second to grab the link from the chat for an evaluation and let us know how we're doing, what you want in the future. And let's get back to Stephanie. Thank you.
Okay, I'll just be a couple more minutes. I'm sorry. I'm going a little bit over. So some reminders during and after problem behavior. So non-punitive discipline, right? So it's really good that we have boundaries that were consistent but firm. Children need boundaries, but we need to be consistent with what we're teaching them and what our expectations are. Children are really smart and they'll know that with this person, I can do this and still get what I need, or with this person, I have to use my words. So you just want to make sure when you're teaching skills and you're changing the way that you respond to problem behaviors, that everybody involved with that child, whether it's at home or in the classroom, hopefully everybody's on the same page, because that's only fair to the child. It gives them consistent expectations. Minimal verbal interaction. So just a reminder, this is to inadvertently reinforce the behavior through too much attention. So during those problem behaviors, avoid lengthy explanations or negotiations. A simple firm no or a brief directive can be more effective. Use what happened during that problem behavior to teach you what to work on during those daily routines and in a more proactive time and place. Teaching feelings and alternative behaviors should occur throughout the day. Again, not during and right after the problem behavior, but working on these skills throughout the day so that hopefully next time the child's upset, we've practiced some of those skills. Remembering to consider how can I prevent this problem behavior and reinforce positive behaviors, and make sure that, it's not always easy, but by remaining calm and composed, we are sharing our calm with that toddler. A lot of times, if they're dysregulated, we need to try to be the regulated, calm ones and model the behavior that we wish to see in our children. Proactive strategies. So the importance of a daily routine, using that anticipatory proactive guidance to prepare toddlers for transitions, creating an environment that minimizes frustration, right? So if we are going to spend that 20 to 15 minutes a day of just solid time and attention, making sure that we are minimizing any areas that we feel might frustrate our toddler, even if that means that now we have some visual supports, or we're pairing our play with more gestures so that they understand directions, or we're pairing these things with their favorite snacks or bubbles or things that they really love and like so that they're motivated and their attention is on us. Linking apologies to hitting and biting in the moment. Again, this kind of brings more attention to hitting, and it could also provide the child with some reinforcement there. Okay. So these last two slides are just some tips on creating supportive environments. So just remembering that we're here to support our child's needs and feelings, being a reflective parent and an active listener, preemptively supporting our children through events that might be challenging for them, really working on communication, really working on building that strong emotional connection, even if it's with or without words. Whatever, we feel is a challenge for them, we're kind of using these steps to understand why it's happening and what we can teach our toddler and how we can support them as they learn those things. Co-regulation is essential for young children. So social support's been shown to increase resiliency. So simply sitting quietly with your child can reduce their stress levels, offering them hugs. If you feel that your child is a sensory seeker and they need a lot of physical activity, having that balance between doing physical things as well as doing calming activities. This is just a slide I put in for your reference on negative versus positive language. So instead of, stop hitting, don't say that, I won't buy you that, just some more creative, positive ways that we can teach our children to listen to us, but in a way that's more positive, but still firm. I really believe that toddlers do, without saying it, they test boundaries because they need them. They want to understand, what to do. It helps them feel safe. So, these are just some quotes that I thought were really good for today. And all of you are loving, compassionate parents and professionals. And oftentimes, the kids who need the most love might ask for it in the most unloving ways. And, that goes for adults too. And I love the one in the middle because it reminds me of my daughters. Children don't say, I had a hard day. Can I talk to you about it? They'll say, will you play with me? So, and we're all imperfect. None of this goes well all the time. I'm a behavior analyst. I make 20 mistakes a day and I'm going to keep it, you just keep trying. All you can do is learn and try to support your child. And I hope that today's presentation helped you to kind of look at behavior a little bit differently. And I'm happy to stay on and answer any questions. That's my email. So if you're looking for any resources on anything that I talked about today, there are certain podcasts that I really like, as well as links to visual supports I've used in the past. I have a lot of resources, so if I can help you be a more effective parent or practitioner, any unanswered questions, you can email me. We can schedule a Zoom. I'm happy to stay on as well, and I really appreciate and am humbled by how many people were here today in the middle of your day. So thank you so much. I'm gonna stop sharing my screen. Okay.
Thank you, Stephanie. There is one question from in the chat. It says how the chat is moving up. How do you children learn to self-regulate? How children learn to self-regulate? I think that's a question. How do you help
So I
children
think
self-regulate?
it's always going to depend on the child, right? So depending on what type of self-regulation skills that child takes to. Some children might do well with something more physical. Some may do well with certain activities that they may find calming. Some might do well with certain sounds they find calming or certain textures. It would really depend on the child. But I always recommend when you feel like a child's getting dysregulated, look for those precursor behaviors. So really looking at, every time my child's dysregulated, these are some things that I'm noticing before they even get there, because our goal is to really proactively help them before they get dysregulated. So sometimes I've done check-ins with kids where I might show them 4 pictures of different activities, bubbles, Play-Doh, squeezes, music, and let them pick which one they might want to do. Sometimes, as I said before, just sitting quietly, taking deep breaths can be helpful. It's always going to depend on the child. There's another child I work with that has a crash pad, and for her to regulate, she likes to jump in her crash pad off the couch into it because it gives her a lot of physical input. So it always depends on the child, but you really want to look at precursor behaviors and really trying to help them before they get dysregulated.
Thank you.
Yeah.
We're gonna stay on for a little bit more. I want to respect everyone's time. If you need to leave, thank you so much for staying with us. Thank you for participating.
Thank you so
If you
much.
want to ask questions, you can unmute yourself and ask away. And thank you, Stephanie, too.
Oh, you're welcome. My pleasure. Someone asked something about cry it out. Oh. Okay, so some of the caregivers leave the child to cry it out and just leave them for 20 to 30 minutes in order to extinguish the behavior. Doesn't seem to work for me. What do you think? So I'm not, again, it would always depend on the family, the child, what's really happening there. I'm not a cry it out person. Every time my daughters cried, I would pick them up and give them a hug. Now if they were biting or hitting or throwing, I would not, but if they're crying because they're upset because of something that just happened, maybe they did bite or throw and it's been 20 to 30 minutes, they need help calming down. So I would kind of go over and try to help. Again, giving attention to trying to calm the child without attending too much giving attention to the behavior, not the child. So I'm trying to change this crying by offering deep breaths and a calming voice, but I'm not really talking to the child. I'm not reminding them of what they're going to earn. I'm not talking to them about what they did wrong, right? So there's a difference between giving attention to the behavior you want to change and then giving attention to the child. So I would not recommend that. I think if after a couple minutes they're not calming down, it's okay to go over and offer some calming strategies.
Thank you.
I don't like seeing any little kid cry, but my son keeps running to. So I would recommend, so somebody had asked a question about their son keeps running continuously. It's fine at home, but not outdoors because he's probably really excited and you're afraid he might hurt himself or get lost. So what I would do at home is, since he's doing really well at home, I would start working on at home the directions that you want him to do outside. So I would also I would download and print out some visual reminders of staying with mommy. Maybe like if we stay close with mommy at the park, then we can, and then maybe he earns like a favorite snack or a favorite show or something, and showing that with like a visual, like first then, but working on the directions that you want him to follow in the community at home. So, okay, let's go get a snack. Hold my hand. All right, let's go get a snack. Walk next to mommy, and really start pairing those directions, since he's doing really well at home, with outside, and really start reinforcing those directions when he follows them outside.
Great ideas.
Yeah. And I would really do visual supports. I have some for being safe outside. I worked with a family that she put on a ring binder, 5 behavioral reminders. So stay close with mommy. We're going to walk. If we run away from mommy, we're leaving. And they would leave. And then after like 2 times, her daughter understood the expectation. What would you do about a child who relies on a pacifier to calm down? Child is 2. Can't calm down without it. That's tough because they're only 2. Let me think about that, Gabrielle. I feel like sometimes if we can offer other alternatives that are new and novel before we offer the pacifier, that kind of like redirects them or distracts them, or we may say, yeah, okay, you can have your pacifier in a minute. Okay, and then kind of like distracting them to something new or exciting to do and seeing if they'll take to that. Because they're only 2. I mean, my daughters had pacifiers kind of late, so but we would schedule time where they can have the pacifier, and then we would also have like a pacifier box where like they would put it in the box and then they would get to have it again only a certain time of day. And then when they were really upset, it was really just working them through other things that they could have instead. A snack that I only presented to them when they wanted the pacifier. So that special snack was only offered when they were asking for the pacifier, but the pacifier was in the binky box. Oh yeah, we called it a binky box. Was in the binky box until later. So like, oh, it's in the binky box right now, but we can have this or this instead. Sometimes that helps, kind of like changing their attention to something else that's new and novel, only when they're mentioning or needing the pacifier. And over time, I have a feeling as their regulation skills get better and their nervous system matures, they won't need the pacifier as much. Okay.
Yeah, those of you who are still with us might want to read the
Yeah, I'm
one of
just reading the question.
comments so that you know Stephanie, I think, is going to try and come up with some ideas, some things to start thinking about for a recent question in the chat about a 2-year-old who in some cases has been getting aggressive and she can't seem to
Yeah.
figure out what the cause is yet. So
Yeah. So what I would recommend doing before, I don't know if your son has any sensory behaviors, but sometimes we have kids who are sensory seekers and sensory avoiders, right? So we have some kids who engage in certain behaviors because they're avoiding sensory situations. We have some kids who are maybe more aggressive and hyperactive, and they have issues with boundaries because they're sensory seeking. I would recommend always doing a physical activity before play dates or before structured activities, to kind of get their energy out. I would offer them squeezes to see if sometimes they're, craving some of that physical input, as well as really looking at he might be seeking attention and play, but just going about asking the wrong way. So working on, how do you play with me, how to ask for play, and then just kind of like being the person in the middle. And if he continues to be aggressive and go after that person, kind of doing what I recommended, 30 to 60 minutes of either removal of it, this is a distinct change. If we hit, if we grab, if we throw, we are removed from this situation. And we can try again, but we're going to have safe hands. Otherwise we can't play with our friends. So really kind of removing him from that when he does it, but being proactive throughout the day, throughout his daily routines on we're having safe hands. We're going to play nicely. We're going to share. We're going to take turns. We're going to keep our hands to ourselves. Otherwise, we're not going to be able to do music class. But I would also recommend kind of getting him a little bit tired out physically before you do those types of things. Or maybe giving him something else to hold as well, kind of like so his hands are busy so that he can't grab or pinch. Okay, let's see. Yeah. Yeah. You can even do kind of like a sensory diet, they say, like every 20 minutes, every 30, it depends on the child, but you would do like offer him squeezes or I've helped several families. It's kind of pricey, but they have a crash pad, it's called. You can order it on Amazon. For kids that are sensory seekers, and they kind of jump into them and they play so that they get that like wrestling physical input through a way that's safer. So you can kind of like play wrestle or jump on the crash pad or do something physical before, and just kind of outlining using those proactive strategies before, like what the expectations are, whether he understands that or you have pictures. Even if you were to Google the images like visual supports for playdate expectations, you'll see tons of different things come up. Just print it out, can laminate it. I mean, who really has a laminator these days, but at their house, but you can print it. And you can cut the squares, put it on like a ring thing and just bring it with you to say like, okay, that's a warning. We're going to have safe hands or we're leaving. And after, they may say, oh, wow, every time this happens, we leave, or I get removed from this situation, or mom's facial expression changes and she's not happy with me. So sometimes it just takes some consistency with how we respond to it. You guys have any more questions? And if anybody on here has any questions on autism, I have like a wealth of resources on that. So if I can support any of you or your children or families that you're working with or children that you're working with, especially in that area, please let me know. Does anyone have any more questions? Did I get them all? I don't want to miss any. I'm trying to make sure I got them all. Yeah.
I
Yeah,
think
you
got
can
that.
email me too. Yeah.
Thank you so much, Stephanie.
You're welcome. I
I don't
tried to like put a lot of information in a short time period.
I know it was a lot. It was good information.
Yeah. Oh, so what age do kids get diagnosed with autism? So, the average age of diagnosis is around 4 to 5 years old, but a lot of the research shows that autism can be reliably diagnosed by age 2. Right now, there are extensive wait lists for autism diagnoses and evaluations. So, there's not as many developmental pediatricians in the state as you would think. So there are a very long wait list, but oftentimes it can be reliably diagnosed by 2. You do have some times where children will go in for a evaluation and the diagnostician says come back in 6 months because they're not really 110% sure. So they want them to come back. But the average age of diagnosis is 4 to 5 years old still. My thoughts on screen time for sensory-seeking toddlers or just all toddlers in general? My thoughts on all toddlers, yeah. My thoughts on screen time is everything's okay in moderation, right? We don't want, but I don't really like using, be selective with what screen time you're picking. I like things like Sesame Street. I know a lot of kids like Miss Rachel where they're actually learning something, but sometimes, we need to, as parents, put on a show so our toddler is safe and engaged. I think the American Academy of Pediatrics recommends, I don't think it happens a lot, but I think they recommend no screen time under 2 and after 2, no more than an hour or 2 a day. Yeah, thank you, Jen. I know the American Academy of Pediatrics has guidelines about screen time. Yeah.
All right. Well, thank you
Thank
so
you so
much.
much,
I
everybody.
know
If you
we
have any
all
questions,
have
just
places
email
to
me.
be, other events. So appreciate you going above and beyond with your time. It was amazing. You answered all the
Sure.
questions.
No
And we
problem.
will be sending this information again to everyone. And please take the time to fill out the survey. That just helps us in the future. We want to hear your thoughts and we want to hear your ideas for maybe next year's webinars. We'd love to hear more about that. So please take a few minutes to fill out the survey. All right. Well,
Thank you, everyone.
everyone. Bye, everyone.
Thank you.
Thank you.
Absolutely.
It was awesome.
Oh, hey, Jen.
Hey, that was awesome.
Thanks.